So this is skill 1316, assisting with extubation of a client with an endotracheal tube. So they're all better. We fixed them. Yay! We get to take out the tube now, okay? So we're going to check the physician's order and gather the equipment and supplies. What supplies do you need? Well, you'll need a chucks. You'll need suction with a Yankar. You'll need a stethoscope. You'll need a mask and gloves. You need a 10 milliliter syringe. Okay, just a syringe. You're going to need some sort of oxygen device to put on them afterwards. Normally it's a non-rebreather. They start with that and work down to other devices. Although I have seen them take it off and put somebody right on a cannula. So, but for purposes of this, we're going to be using a non-rebreather mask, okay? All right. So we checked our physician's order, and we gathered our equipment and supplies, and we performed WIPSA, okay? So then we're going to place the client in a Fowler's position, which they are. Okay, we could actually go up a little bit more if we wanted. Okay, up they go, up they go. All right. And place disposable cup in the client's chest. And at this point, we want to take some vital signs. Okay, why is that important? Because you know this is traumatizing. So we want to make sure that they're doing okay. We're going to be doing taking out a tube. It can be causing anxiety. We want to know what their saturation is prior to taking it out. We just want to know where they're standing, okay? All right. So we're going to don clean gloves and personal protective equipment. So that means I'm going to put on my mask, okay? Okay, so then I perform oral and nasopharyngeal suctioning. So prior to taking out the tube, we're just going to take our Yankar, we're going to get that subglottic space in there, get as much fluid and gook out as we can, okay? All right. Then we want to have the client take several slow, deep breaths. At this point, the doctor will put the syringe on and withdraw the air out of the balloon that's in there, okay? Okay, then we're going to disconnect the ET tube from the holder. Okay, so we'd unclamp and take that, okay? All right? And then we would ready the suction. We'd have this ready while the clinician takes out the ET tube. So they've taken out the ET tube, put it on your chucks on the bed, and we're going to be suctioning, okay, suctioning and applying the O2 almost simultaneously. Keep the suction close by in case they're coughing, and you can suction out, okay? Sometimes RT may be doing this in some facilities, okay, just to let you know. So hopefully the physician has put that ET tube right on that chucks for you. You're going to monitor the client frequently at first and then regularly. What do I mean by monitor? We're going to check in their saturation, their respirations, their blood pressure, their pulse, their color, okay? We're going to make sure that they are breathing independently on their own, okay? We're going to be staying with them for a little while after the tube has come out. Then we're going to frequently check on them, 15 minutes, 30 minutes, depending on what your facility is, depending on the acuity of your patient, okay? And then it gets to be just more regularly once you notice that they're going to be able to breathe on their own, okay? Then at this point, you're going to dispose of your equipment, okay? You're going to return the bed, make sure the bed's in the lowest position. You're going to take off all of your protective equipment. You're going to take off your gloves, wash your hands, and document your client's response to being extubated. Okay? So that is skill 1316, assisting with extubation of a client with an endotracheal tube.